Good afternoon, and thank you all for joining us again. I'm Kathy Roth-Duquet, the CEO and co-founder of Blue Star Families. Blue Star Families is a national nonprofit supporting active duty, Guard and Reserve, transitioning and veteran service members and their families. We support military families to strengthen communities. I'm joined, as always, by Matt Boren of Association of Defense Communities. Matt, let me turn it over to you.
Thanks, Kathy. For over 40 years, the Association of Defense Communities has been supporting the resilience of communities and states that support America's military. With nearly 300 communities, states, regions, and affiliated industry partners, ADC represents every major defense community and state in the nation. The COVID-19 Military Support Initiative has a goal to provide resources and expertise to support communities, states, and military families throughout this crisis. We'll be hosting events like today. We have a daily newsletter and a robust website that includes links to important resources as well as recordings of our past webinar events. The important work of this initiative would not be possible without the generous support of our sponsors. The initiative is powered by Booz Allen Hamilton, with significant support from USAA. I also want to recognize the Bristol-Myers Squibb Foundation, the Association of Military Banks, the Military Housing Association, Hunt Companies, J.P. Morgan Chase & Company, and First Command Financial for their contributions. One of the important goals of the COVID-19 Military Support Initiative is to bring together groups from across the military community, local and state government, and industry to build collaboration that helps our families and communities. I'd like to specifically thank the group of organizations that are supporting this effort through the White Oak Collaboration. And I also want to thank all of the groups that we've been working with at the national, state, and local levels to make this all possible. All of our partners are instrumental in providing the resources we share and for bringing together many of the webinar panelists, including those that are going to be featured today. Back to you, Kathy.
Thanks so much, Matt. To start off today, I'd like to welcome a great friend and a great military advocate to share a few opening remarks. Mrs. Maria McConville is the spouse of General James McConville, Chief of Staff of the U.S. Army. Before starting her own nutrition consulting business, Maria worked for a number of years in the health organizations and long-term care facilities. She's intimately aware of the sacrifices military families make, and frontline workers who are on a daily basis have been helping and amplified in this crisis. Fitting for our discussion today, Maria is the visionary behind the Spouse Master Resilience Training Program, a program that I feel is so applicable right now. We really appreciate, Maria, the way you've been rolling up your sleeves and working so hard for families. We're thrilled to have you with us today. Maria?
Well, thank you, Kathy, for those kind words. And thank you to ADC and all the agencies and partners for all you do for Army families, especially in light of COVID. It's really inspiring. I can absolutely empathize with the unforeseen stressors of telework, as many businesses for the last 7 years. That's what I've been doing. So like a lot of other businesses also, I've been negatively impacted by this pandemic. I'm an Army veteran and I have been an Army spouse for 32 years. My family, like many of yours, is also negatively impacted by COVID. Our oldest son is an Apache pilot who's scheduled to undergo some specialized training in May. He's waiting to hear if that's a go or not. Our daughter is a licensed clinical social worker and embedded behavioral health officer. When she reported to her new duty station last December, she was told she would be deploying to Afghanistan this spring or summer. However, in the past 2 months amid COVID, their deployment seemed to be on hold. But just a week ago, she found out that she, in fact, will be deploying this coming weekend. Her husband, an infantry ranger, will hold down the fort at home. Our youngest, a medevac pilot, has been on rotation in Germany since October and is due to come home in June. It seems that he may also be delayed. So many of these past weekends, the kids have called my husband Jimmy, asking him if they will in fact train, deploy, or redeploy. And Jimmy has told them he doesn't know. I guess they think that as chief of staff, Jimmy should know everything about the Army. So they call or text me later saying, Dad must know. But I assure them that he doesn't know. No one knows about this invisible enemy and how things will be handled tomorrow, let alone today. I can assure you our senior military leaders are working tirelessly to best assess the situations affecting all soldiers, not just ours. One of our topics for today is self-care, and self-care does not look the same to everyone. What is self-care to me may not be self-care for you. The important thing is that we give ourselves permission to self-care. I know a lot of times as parents, we think that we always have to put our kids first, but if we're not taking care of ourselves, we may not be doing a very good job taking care of our kids. As Kathy mentioned, during these trying times, resilience is paramount. Before Jimmy took command of the 101st in 2011, we received a briefing about the Master Resilience Training, a program the Army was instituting with soldiers. I was so intrigued, and I knew there had to be a way to offer the training to spouses. I worked with the comprehensive soldier fitness team from the Pentagon so that we at Fort Campbell were able to pilot the first spouse Master Resilience Training. Since then, many soldiers and spouses have conducted the training as well as reaped the benefits from the training. One way of describing resilience that I especially like is handling adversity with integrity and grace. I often ask myself that question when I'm facing adversity. Am I handling this with integrity and grace? If not, how can I? I've been able to connect virtually with our senior spouses, and I'm so proud to tell you all the good news stories I've heard. I'm going to give you a couple examples of the responses I received when I asked what our families were doing to cope. Chaplains, military life consultants, and trainers from Army Wellness Centers are providing services virtually, which has gone over really well. One installation is discussing isolation in their single soldiers barracks with Army families, children, and DA civilians teleworking. This is a joint effort between the behavioral health teams, chaplains, BOSS leadership, and ACS. Residents can complete a self-guided history walk along one post historic sites, and many installations have various types of scavenger hunts going on. At one overseas location, MWR and ACS donated fabric and elastic while spouses rallied to make mask-making kits which could be sewn at home or at the Arts and Crafts Center. They called their project SEW, S-E-W, Essential, and they donated more than 2,000 masks to hospital, DECA, AAFES, and other frontline workers. Colorful chalk is turning neighborhood sidewalks into art galleries. Families are having themed dinners using their fine china that they haven't used in years and trying new recipes together. Soldiers and family members have been keeping each other accountable for their workout routines through virtual and newly created park courses throughout their neighborhoods. Army soldier and family readiness groups have taken on a new look. SFRG meetings are being conducted virtually with higher attendance than ever before. These good news stories of our soldiers and families demonstrate not only resilience, but creativity and kindness too. Army families are not just surviving in crisis, Army families are thriving. And I cannot be more proud of our Army spouses, soldiers, and families. I'm extremely grateful to Blue Star Families, ADC, American Red Cross and TAPS, and all the other organizations and individuals who have contributed to this coalition, helping to identify the pain points, rally the resources, and mitigate the challenges faced by our military. Thank you for all you've done and will continue to do to help the military and their families continue to build their resilience and continue to thrive.
Thank you. Thank you so much, Maria. Those were great remarks, and I found them very inspiring. Before we move on to our panel discussion, and we're going to be bringing on the Red Cross, and here's Kobe Langley, who will be joining us. I want to just share a few bits of data from our Pain Points poll. So as you know, CMSI has been conducting a pain points poll for the last 5 weeks to track how people are experiencing things over time. For the first time this week, we are roughly at service averages for participation. We think that's great. We have a good cohort of veteran families as well. We want more. We ask everyone on this call to please take the pain point poll again, even if you've taken it before, and please encourage your colleagues and your lists to take it as well. Next slide. A couple things we want to point out with the new extension of stop orders, we saw a spike up of concern about folks who are going to be making 2 lease or mortgage payments coming up. We have nearly a third of people who are looking at that within the next 60 days. That problem had been resolving over the last few weeks for the after the first stop movement order. We hope to see that number resolving again as people become aware of the resources that are out there for them. We have a lot of those resources listed on the COVID-19 military support website. They are, of course, on Military One Source and available through units. All of us need to work to get those resources out to our folks. Also, we want to point out that about 1/5 of both military and civilian mission essential personnel who need childcare don't have it. So that childcare crunch is still real and still needs more resources. Finally, 68% of military family respondents, 62% of veteran family respondents are feeling increased stress. I think organically we all get that. There's more. That's why we have town halls such as this one and training such as the one that Maria McConville mentioned. Next slide, please. Spotlight on mental health. We do want to point out some good news and some of the positive, graceful actions that people are undergoing. 68% of folks, among those who are proactively supporting their mental health, military and veteran respondents are finding ways to feel better by virtually connecting with friends and families, taking care of their physical health through regular exercise and walks. We're finding that those 2 methods are really making a difference in people feeling better, and we encourage people to take that on. And finally, to spotlight on school-age children. Stories of strength. 39% of military family respondents say they've grown closer to their school-age children as a result of social distancing. That's something to celebrate. We are interested in both answering the challenges and also reframing the challenges to find silver linings where they exist. Now, I look forward to moving on to our panel discussions. Last week, we had a wonderful and powerful conversation about psychological impacts of COVID-19 and ways to engage, take care of yourself for resilience. We're looking to go deeper into the mind and body initiatives. How do we take care of ourselves physically at home? And also, how do we take care of our mental health, including more acute issues such as grieving? Our first briefing, led by the wonderful folks at the American Red Cross, will be led by Kobe Langley, who not only leads a couple offices at the American Red Cross, but also is on the board of directors for Blue Star Families. Our second panel will be organized by Tragedy Assistance Program for Survivors. It will be led by Bonnie Carroll and her team, who do such important work for the military community. And Bonnie has been an important mentor to me. So let me introduce Kobe Langley, Kevin Kelly, Liz Bubel, and Lynn Crabb.
Thanks for that introduction, Kathy. Great to be here with you. Folks, so it's a great opportunity for me to talk from the American Red Cross perspective about the services that we can provide to the veteran military family community. As Kathy mentioned, I'm Senior Vice President of the American Red Cross. We work with more than 14,000 volunteers and 300 staff that are supporting our veteran military family community around the globe, to include in current conflict zones. I wanted to say a particular thank you to Blue Star Families, who's a persistent leader in communication and in direct services also around the world. I want to say thank you to Booz Allen Hamilton and also our wonderful partners in defense communities and TAPS, always a consummate partner with us, and we share a lot of resources and support. This is an important time for all of us to think about the unthinkable, a disaster within a disaster, how to take care of our families and ourselves. The American Red Cross responds on average to more than 60,000 disasters every single year, and 95% of our disasters, our relief workers are volunteers, and nearly 25% of those are veteran or military family members. Last year alone, the American Red Cross provided more than 1.4 million volunteer hours in support of our veteran military family community, working in military treatment facilities, as well as in our Hero Care Center, helping getting service members back home to take care of their loved ones. I'm joined on the call by Lynn Crabb, our Director of Programs and Policy, who will talk about the new behavioral health module. I'm also joined by Kevin Kelly, Senior Director of Community Preparedness, and Elizabeth Bubel, who's a Senior Associate for Program Development. If we can move to slide 2. Wonderful. The American Red Cross is mandated, as some of you already know, to provide assistance to our military families, as well as to provide support to the National Response Framework as a part of the United States National Disaster Response efforts. On average, we serve more than 1 million discrete military and veteran family members every year with our programs and services. And today, we're sharing with you several resources that are available to improve individual and family readiness as we begin to see increased stressors due to weather-related events and natural disasters, contemporaneously with diminished first responder capacities, complexities in supporting our community and social service resources, and the complexities that ultimately diminish the ability of those social services to provide support in a disaster. These are things that would typically be available to support our military family members during a disaster. So with that, what I'd like to do is I'd like to turn it over to Lynn Crabb to begin the discussion about resources that are currently available around resiliency. And then we'll hear from Elizabeth Bubel, who will talk about disaster preparedness activities, both at the individual and family level. Thanks.
Thanks, Kobe. It's a pleasure to be here with everybody. And this slide that's up now talks about the new virtual resiliency module that we have available. So the American Red Cross has been offering in-person resiliency modules dealing with communications issues, stress, depression, that kind of thing. And these are usually offered in person, again, small groups, but we've shifted a little bit and now offer this module that's specific to COVID-19 and to military and veterans and their families. So this is facilitated by a licensed mental health professional across the country, and it's organized through your local Red Cross. So it will be a small group, again, 10 people at most, with a licensed mental health professional leading the workshop. And it's really skills building, helping to deal with some of the issues that are coming up during COVID-19, and really trying to ensure that you can support yourself, your family, work on some of those communication issues that might be coming up. So we recommend that you get in touch with your local Red Cross, and the link will be here in the presentation so that you can find out more about a potential workshop in your area. And also on here, we've noted that there's a Hero Care app that the Red Cross has, in addition to several of our other apps that are very popular and a good resource right now. The Hero Care app is available there. You can see, you can text Get Hero Care to 90999, or you can click the link and go right to that app. So I'm going to turn it over to Liz, and we'll hear more about some of the issues that are presenting themselves now during the spring disaster season. Liz? Liz, we can't.
Are you able to hear me?
Yes.
All right. Well, my headphones gave out, so I apologize if you have a tinny sound. Next slide, please. Okay, I just wanted to thank Kobe and Lynn, and thank you to our families for inviting us to present today. Thanks for Maria. Those were very inspiring remarks. I am very excited to be here with you. I come from a military family. My father served in the U.S. Army, and I was born in Marshall, Germany, and then spent time in Fort Dix, New Jersey. My grandfather was a brigadier general in the U.S. Air Force, and we all had to call him general. My grandpa. So I have tremendous respect for our military families and the sacrifices that you all make, and thank you so much for your service. I've been with the Red Cross Preparedness Unit for 5 years.
Liz, it's Kathy. We're having a hard time with your video, your audio. It's very garbled.
Okay. Okay. Is that better?
It is still, is your, you know, I wonder if it might make sense to have you call in, and maybe we'll have Kevin go ahead while we get.
Sure. No, Liz, I'll go ahead until you you can call in. Can you hear me okay?
You sound great. Thanks, Kevin.
Okay. Well, thank you, first of all, for having us. And what we'd like to do today is share with you a number of resources that we have prepared or we've modified to help you and your families prepare for disasters during COVID-19. I won't read the slides. I'll basically just go over them quickly to touch upon the highlights. But what we've done here is we've provided a number of links that are live to this presentation that I understand will be made available to you after the presentation. But essentially, we have some tools to help you identify likely disasters in your area, a free emergency app that is available in both Apple and Android phones that you can download. There's a Red Cross library with preparedness checklists on it, things that you can do to make yourself and your families safer, that is tailored to specific disaster hazards. So you can pick a hazard that is one that may be prevalent in your area, your geography, and then you can help plan.
I'm on now.
Okay, Liz. All right. Go ahead.
Sorry about that. Okay, great.
All right.
Great.
Thank you.
Sorry about that, guys. I apologize. I think I have some Wi-Fi issues. I'm calling from Chicago. Maybe we have got some weather coming through. Can you all hear me okay now?
Yes.
Okay, great. I'm sorry about that, folks. I did want to just, I understand that Kevin got through a few of the topics. I just wanted to recognize that we're all going through very challenging times right now. COVID-19 is likely to be with us for a long time, and that's why we must prepare a little differently for disasters. It's difficult to think about, but hurricanes and wildfires can still strike. So knowing what hazards can affect your community and learning what to do before, during, and after each one will help you and your family stay safe, and also strengthen your ability to adapt so that you can recover or bounce back quickly. There are actions that you can take to prepare while still protecting yourself from COVID-19 during a disaster. So in this slide, we want to think through your specific area. Which disasters could I face, right? You think about your own family and your own situation where you're located right now. You may be in a new area. You may be in an area that is has a whole new disaster profile. So the Red Cross has a nice interactive map to identify likely disasters in your area. You can also download the free emergency app, and I love this thing. I use it constantly. You can search American Red Cross in the App Store and download it. It's free. It's in English and in Spanish. We also have a variety of resources on our website. You want to make sure that, you know, don't get lost on our website because there's a lot of stuff in there. But if you click on that link, you'll go right to the Red Cross Emergency Library. And there you can kind of familiarize yourself with some of the actions you need to take before, during, and after. You know, I know a lot of people are moving around a lot and things like that. I just moved to Chicago. I was in Virginia before. One of the best things I've ever done is just signing up for alerts, and I get in contact with my state, local, or government agency, state emergency agency, or those kind of things. They have a variety of resources, but it's really not, you have to find them. They're not gonna hunt you guys down. So the second question you want to think about is, how will I meet my basic needs and the needs of my family in a disaster during a pandemic? This is a very complex time. We know that disasters can cause sudden challenges like knocking out power, blocking roads, disrupting emergency services, and causing stores and pharmacies to close for an extended period. COVID-19 adds to this complexity. Prepare now so you have the critical skills and you can meet your basic needs. So in this aspect of emergency preparedness, you really want to think about skills and supplies. What life-saving skills would benefit you and your family? Learn first aid, learn CPR. The Red Cross has a variety of online classes to learn these skills. You could take advantage of the time we're all in quarantine. You can also download, we have a free first aid app. That's like a hidden gemstone. I know that folks are discovering that now. That is a separate app from the emergency app, but it covers all the first aid content. And that can be very helpful. You can search American Red Cross in your app store. The second, so you got your skills, right? Remember, you need skills because you may be, emergency services may not be able to respond right away. Now, the stores are closed, pharmacies are closed, we're in a COVID environment. That means we do have to have our supplies, right? We recommend a couple of different aspects of supplies. So you need 2 weeks of emergency supplies, and that includes everything you need to stay at home for at least 2 weeks, with items such as food, water, household cleaning and disinfectant supplies, soap, paper products, personal hygiene items. We kind of did this drill, and we're doing it now for COVID. We're just hunting around looking for stuff. My husband's still looking around for toilet paper. There's shortages still. So when you build this kit, you may need to go little by little, right? Because we won't be able to stockpile everything right away. The second, what you want to do is you want to have 3 days of supplies in a go bag. And this would be a lightweight, smaller version you can take with you if you have to leave your home quickly. You need everything you need to be on your own for 3 days: food, water, personal hygiene items. And because we're in a COVID environment, don't forget about cleaning and disinfectant supplies that you can use on the go, like tissues, hand sanitizer with 60% alcohol, and disinfection wipes. These might be hard to find, so start now. Start looking around for things that you can use. We talked a little bit, you guys have been doing a lot of work with cloth-based coverings. The CDC has a website, has a how-to with sew and no-sew methods, because if you do have to evacuate your home, you are going to have to be prepared to use a cloth-based covering for everyone in your household who can wear one. These cloth-based coverings should not be a substitute for physical distancing. Wear your cloth-based covering as you maintain or do your best to try to keep about 6 feet between yourself and others while in public. I've seen a lot of kids outside. They're really small. They look like they're 1 year old, and their parents have a mask on them or a cloth-based covering. Remember, cloth-based covering should not be placed on young children under age 2 or anyone who has trouble breathing or is unable to remove it without help. Okay, the last part you need is 1 month's supply of prescription medication, as well as over-the-counter medications like cough suppressants and fever-reducing drugs and medical supplies or equipment. Those are very important in case you need to If you start to feel symptomatic or things like that, you need to have fever-reducing drugs and cough suppressants. You want to keep these items together in a separate container so you can take them with you if you have to evacuate. Next slide, please.
There you go. Liz, I'm going to jump in. I want to invite our audience to use the chat box to send in questions. And Liz, we want to try to get to questions. So maybe if you say a word about each of the slides, and we'll go through them, make them available, to folks offline, and
Yeah.
be able to get those in. Great.
Great. Okay. This slide has a lot of information on it. But what I want to point out to you all is the question you have to ask yourself is, how do I make a disaster plan during a pandemic? We need to understand that different kinds of hazards will happen alongside COVID-19, and we have to prepare for before, during, and after each disaster. Please know that last resort protective actions are usually not effective, so that's why you need to prepare. Be sure that you can find out quickly about a hazard. You can't react quickly if you don't know about it, right? So register to receive free emergency alerts that your community may offer. Consider purchasing a battery-powered radio or downloading the free Red Cross emergency app. It does have a notification setting. This is very important. Because of COVID-19, you need to stay current on advice and restrictions from your state and local public health authorities, as it may affect your actions and available resources and facilities. The last point I'm going to think about is I'm going to let folks know about is, you got to think through. Some disasters will require you to stay in place to stay safe in a specific area of your home. Other disasters will require you to go somewhere else to stay safe. If you need to go somewhere else, think through these questions. Where will I go? How will I get there? Where will I stay? And how can I protect myself and my family from COVID-19? There's some good resources there. A lot of folks have friends and relatives outside their area that they usually stay with during an emergency, like a hurricane or things like that. Check in and see if they have symptoms of COVID-19 or have people in their home at higher risk for serious illness. If they have, then make other arrangements. That's just a good neighbor approach, and will help with the next slide. Okay, the last one is, this is a tenet of preparedness planning. You got to think about it. If I'm separated from my family, how can I reconnect with them? Especially if communication networks are down. We have the complete a contact card. There's a link in there where it's a pre-filled thing, and you can use it to adapt. Make sure that everyone in your household has one and they carry it with them. Don't forget, in the event of an emergency, text messaging is usually best. A text message may go through when a phone call will not, and always designate an out-of-town contact who can help your household reconnect. It may be easier to reach people outside the affected area. The last thing to think about is, what critical documents do I need to recover quickly? We hear from disaster survivors all the time, and they said, if I could do something differently, I would have had a backup of my important documents. I couldn't get aid, I couldn't get any assistance until I proved my identity. All my stuff was lost. So you want to have these kind of critical documents: birth certificates, digital photos of loved ones updated every 6 months, especially your kids, and medications, and valuable photos. This is a great resource down there. I encourage you all to take a look at it. The Disaster and Financial Planning and the Emergency Financial First Aid Kit. Next slide. I do have a lot of additional resources that you guys can look at. I won't go to them in detail, but it allows you to have like a cheat sheet to find some resources. So always use, when you're looking for news about COVID-19, always use credible resources, CDC, American Red Cross. Next slide.
And I think we can let
here's some,
people,
yeah.
we can let
Okay,
people,
thank you. That's all.
Yes, thank you, Liz.
Thank you
It's
so much.
Thanks, so much great information. And I know I actually downloaded the first aid app while you were speaking, the Red Cross First Aid,
That's awesome.
and it's awesome. Kobe, just for a last word, I want, when you and I were talking about this time, we were talking about the whole concept of readiness. And I think that's something military families really understand. I wonder if you want to just help us wrap up with, how we can think about readiness in terms of our larger lives, our families, our homes at this time of COVID. Oh, I lost your video. Kobe.
Can you guys hear me?
Yes, we can hear you.
Okay, great. Well, you're going to have to ignore my daughter who's practicing piano in the background if you can hear her. But what I'd like to say first and foremost is thanks again for the opportunity to provide some advice and some suggestions. But resiliency is most important for the folks in this call that are providing direct support and services to our veteran military family community. It is quintessential that we take care of ourselves first so that we can take care of others. And to the extent that individuals are looking for supportive services to help take care of themselves, you can definitely reach out to the American Red Cross and many other providers that provide support through the White Oak Initiative. And so I would encourage everybody to think particularly about behavioral health supportive services that are available to you. Our resiliency workshop is now online. That's part of the links that we shared with you, and we'll make sure that we provide those as well. But we have to take care of ourselves before we can take care of others. So our own individual and family readiness has to be paramount during COVID-19. So thanks for the opportunity to speak with you all today. I really appreciate, again, Kathy, your support for all of our work, the White Oak Initiative and military communities. Thanks.
Thanks, Kobe. And that was so much great information. I really appreciate all the Red Cross is doing and each of you on the line. And now I'm excited to move on to our next panel. I'd love to introduce Bonnie Carroll, TAP's president and founder, U.S. Air Force Reserve veteran, and Army surviving spouse. Also introducing Audrey Bagelsdick, TAP's vice president of survivor services, Navy veteran and Navy surviving spouse. Deborah Skillman, who's the director of casualty, mortuary affairs, and military funeral honors for the Office of the Undersecretary of Defense for Personnel and Readiness. And Ann Duff, the director for the Office of Survivor Assistance, the Department of Veterans Affairs. Bonnie, I'll turn it over to you.
Great, Kathy. Thank you so much. We're really grateful to be on this panel talking about military grief during a time of pandemic. And I'm so honored to follow my dear friend Kobe Langley and the team at the Red Cross. We have walked shoulder to shoulder for the past 26 years, providing support to all those impacted by difficult circumstances and traumatic loss. I'm also very, very grateful to USAA, to Booz Allen Hamilton, and to the whole team at the Association of Defense Communities and Blue Star Families for hosting this panel. So I'd like to start out, if we can go to the mission slide there, and just share with you just a little bit of background about TAPS. Our organization was founded 26 years ago to provide support, comfort, and care to all those grieving the death of a military loved one. Our focus area is on being the emotional support and the resources, complementing what the casualty mortuary affairs staffs do so beautifully to give families that wraparound support they so need and so deserve during the loss of a loved one. Go on to that next slide. We'd like to give you some updates. The first 2 weeks of April, we sent surveys out to our surviving family members at TAPS. In 2019, we had over 7,000 new survivors who came to us for care and resources. And this year already, we've increased that capacity, now seeing about 23 new survivors coming to us each and every day, 7 days a week. So looking at just some of the information that we're receiving from those surveys, we've had 1,431 respondents in that 2-week period. And that's given us a tremendous amount of insight to how our families are doing, what survivors need, what they're concerned about, and where the gaps are that we can help fill. It also gives us insight into how this population is coping, where the resiliency is. So let's look at some of the things that we discovered. Go on to the next one. Great. You know, it's interesting that we noticed that 90% of our family members were, our survivors were concerned about their family members. And then 82%, almost all, were also concerned, and feeling an increased sense of their own grief and depression and anxiety, bringing out feelings of isolation and loneliness and loss. So it's been a time when we've redirected our event-based staff. We do so many camps and seminars and retreats over to providing that direct survivor outreach, along with our survivor care team, our peer mentor program, and all the other support that we offer survivors. This is a time when we need to reach out to each other, to provide comfort, to provide support, to check in on what care is needed. Our casework team does an extraordinary job, and I'm so grateful to folks like USAA and Booz Allen Hamilton who support nonprofits such as ours, Blue Star Families and Red Cross. They allow us to be there to offer the resources so critically needed for families. We also found that, surprisingly, maybe something you didn't quite intuitively think, that 64% of the survivors responding, of those 1,400, don't receive government benefits. We kind of think that military survivors are the widows and children, but actually it's the parents, it's the siblings, it's the adult children, it's the friends, it's the battle buddies. It's those who may not be receiving dependency indemnity compensation or the survivor benefit plan. And that's where we as a community can wrap our arms around them, honor their loved one, and help them through these difficult times as part of this family and this legacy of American service and sacrifice. And then we saw 37%, over a third of surviving military families were already seeing a decrease in income, impacting their family's ability to cope during this difficult time. So go on to the next slide there. I hope you all will have a chance to visit our site that we've just stood up. It's taps.org/COVID. Very, very simple. And we've got some robust information updated daily, taking you to each state's government page, taking you to the information that the government is doing right now, currently. It's also sharing resources for those who are grieving a loss. We have a page that's been used quite a bit by our partner organizations working in grief and trauma up in New York and in other areas that have been hard hit. It includes the Mourner's Bill of Rights that Audrey's going to be talking about shortly. And with that, I'd like to pivot over and really get to the heart of our presentation today. Audrey Bogelsdijk is herself, as Kathy said, a Navy veteran, a Navy surviving spouse, and she is our Vice President of Survivor Services. So Audrey, thank you for walking us through the support and the resources and comfort that TAPS offers.
Bonnie, thank you so much for that introduction. It's a great opportunity today to talk about the 26 years that TAPS has been working in grief and loss. There are things that we've learned along the way through our connection to the military. 5 things in particular that we've really identified recently as it relates to how we can understand what the civilian population is going through as well, the first responders, our nation truly through this difficult time. The first thing I'd like to talk about is that family and community are our bedrock. In the military, when we raise our hand and pledge to serve our nation, we know that that takes us away from our families, and we are accustomed through our military service to connecting with new families that we create for ourselves among our military community, and we do that over and over. Each time we're PCSing to a new location, it's really our responsibility that we take on to plug into that community, and there's never been a better time than now for us to do that. We know that resiliency resilience is within us. We've had numerous people on the call already talk about resilience. In the military, there's this attitude that we know that we can do it again because we've done it before. And we know that whether it is grieving a loss of our loved one who brought us to TAPS, or if it's other situations that we've endured throughout our lives, we know that we can lean back on those things and know that because we have done it before, that we do really have that within us. And it's a matter of identifying that community and identifying those resources that can help us be successful. And that's what TAPS is here to help connect people with in this time, not just for military, but also for our civilian partners. We also embrace perseverance. If there's one thing we know, that grief is a marathon, it's not a sprint. And much like this time that we're going through with COVID-19 and all of these social distancing policies across the country, we know that this is not a short-term situation that we're dealing with. For some of us, we don't know when that end date will come, and we're just waiting. But we know that we can persevere through that. And again, we lean on our resources to be able to run that race. We also know that we are the living legacy of the people who have loved us and have moved on. And so we also persevere to be able to honor those loved ones. We understand loss as well. C.S. Lewis said, "No one ever told me that grief felt so like fear." And I think in these unknown times, the unknown can bring fear, and that fear induces anxiety. And so how can we lean on one another? Those who have understood loss, that's the benefit of having this peer support model that TAPS has espoused for 26 years, is leaning on those others who have gone through those times because they do understand loss, and we can find that acknowledgement and that comfort in being surrounded by those who truly can understand the journey that we're on. And then ultimately that we thank God for the little while. There's no amount of time that would have ever been enough to have with our loved one who passed. That is true across the board, whether you're a military loss survivor or you've lost anyone in your life. There's just no replacement for that little bit of time. And so we lean into the future with as much intent as we can, with gratitude, which is not an emotion. Gratitude is not emotion as much as it's a mindset that you are going to be consciously thinking about the gratitude for the time that we've had together with our loved ones. If we can advance to the next slide, what I really love to show you is the Mourner's Bill of Rights. And we've adapted these slightly, you'll see on the website, to address this time now, this period that we're going through, this COVID-19 difficulty. But you know, it's interesting that we should have to say that permission is something that we give ourselves, and we understand the words Bill of Rights, but what are our rights really as mourners? And when I say mourn, I don't always just mean a loss to death. It could be the loss of a job. It could be the loss of a pet. It could be loss of a friend, or any of the other numerous losses that we've experienced through this time, the loss of income. And so I just want to share a couple of thoughts as we go through these points. The first one being, you have the right to experience your own unique grief. This is an individual journey for each person. You don't have to abide by someone else's rules for what maybe culture says is how you should identify and relate to your grief. Allow yourself to have that individual grief journey and take cues from yourself, as opposed to taking the cues from others. You have the right to feel a multitude of emotions. Some people will tell you that there are 5 stages of grief. I'm here to tell you that 5 is just scratching the surface, and that you will wax and wane between them. It's very much like a roller coaster. There may be days that are good, there may be days that are bad. It's very much a roller coaster of a journey, and all of those emotions that you are experiencing are really informative for you. Some of them may be scary. It may feel like it's difficult to pull yourself out of that pit if you find yourself in that emotional pit, but know that there's always an upside, and those emotions can be managed, and you can have the support of others to help find coping tools that can help see you through them. You have the right to experience grief bursts. Grief bursts are something I also think are very much aligned with fear. We're afraid that if we have one of those moments where we have this emotional burst of grief, that it'll be very much like trying to put the lid on a can of worms, and we just simply are afraid that we'll never be able to contain that again. You have the right to embrace your spirituality. Many people will use cliche to help to try to support or help through a period of time and say that there's a reason for all things. We would say encourage yourself by engaging in your spirituality in the ways that make sense to you, not abiding by others' rules. That you have the right to reach out. Yes, ma'am.
We only have about 6 or 7 minutes left, and rather than, and I think people can see this really beautiful list of rights. I wonder if I might might ask some questions that are coming in, and maybe
Absolutely.
we can refer back to some of these as well.
Absolutely.
What are some of we are all, a lot of people, even without the loss of a loved one, are experiencing things that are a lot like grief right now because of the changes, whether it's a high school or senior who's lost their idea of what their experience of their senior year might be like, whether it's people who are looking forward to the homecoming of a loved one and they're grieving for that, or just the loss of a future that we can be confident in. What are some of TAPS, whether this is for you or any of the other members here, what are some of the lessons learned from TAPS that you can share broadly?
I think the first thing that comes to my mind is that we need to be able to lean into our creativity. There are a broad variety of ways that people are finding support, and we're leveraging technology. All of our events, most of our events have previously been in-person events, but we're finding new ways to be able to engage. So we're preparing to do, for example, to use your example of graduation, we'll be doing a virtual graduation ceremony for all of those families within TAPS. We need to be able to identify new ways to find solutions for ourselves and tap into the communities that we've built. Bonnie, did you want to add to that?
I just wanted to give both Deb and Ann a chance to just share briefly all the good work that is happening at the VA and DoD. Deb, could you just, I would love to hear from you. Let's see, Ann, are you on?
I'm sorry, Bonnie, can you hear me?
Yeah.
Bonnie, are you there?
Yes, we can hear you.
Okay, sorry. So thank you so much for allowing me to participate in your panel today. So, unfortunately, our office, is still in business. So for many of you, if you don't know what my office is responsible for, we oversee the policy for the Department of Defense and how we take care of our survivors, both the deceased family members and also those who have been injured or ill and are hospitalized. And it's a little challenging time for us right now because of the social distancing, and much of what we do requires that we interact in close proximity with family members, whether we are notifying them of a loss of a service member, providing travel assistance to bedside, helping them obtain a new DEERS card or file for their benefits entitlements, or providing military funeral honors. So the department has had to adjust some of our procedures on how we provide those services to family members. The Secretary of Defense has put out many policy guidance on travel restrictions because of all the states that have imposed their own travel restrictions to us. But nonetheless, we are still providing services to family members. Generally speaking, we do about 250,000 plus military funeral honors every year. And in just this past month, we've already done over 12,000 military funeral honors. It has required that some family members even make a further sacrifice than the loss of their loved one, which means they may have to defer a funeral. We have some family members who are receiving their flag while sitting in a car because to maintain that social distancing. But when we can and the travel restrictions allow, our teams are out there providing military funeral honors. And in some cases, family members make the decision to defer them until a better time that they can honor their veteran. The service casualty offices are still there to support family members. Many of them are teleworking, but we are, our leadership is very much for making sure that our service members are in person with survivors when we are able to do that. So that means family members still travel to Dover to witness the dignified transfer, and we take all the precautions necessary to ensure their safety. Family members, of course, are taken to the bedside of their injured or ill service member when that travel warrants. And of course, the department goes through many lengths to make sure that our survivors are protected, as well as the service members are taking care of them. So our procedures have changed.
but we are always here. And for those survivors who are grieving right now, and they can always count on the department to be there, and their assistance officers to be there as well. So I don't want to take up a whole lot of time. So if anyone has any questions, that's about it from me, Bonnie.
Great. Thank you so much, Deb. And Anne, could you share from the VA perspective?
Absolutely. Thanks for having me. So my name is Ann Duff, and I'm the Director of the Survivor Assistance at the VA. So, you know, we work hand in hand with Deb and her folks, and, you know, I know we only have like I only have 1 minute, so I just want to say, you know, if you have any survivor benefit questions as far as the VA is concerned, we have a number. The number is 1-202-461-1077. And of course, we're not in the office now, we're teleworking, but we'll get back to you within 24 hours. Or you can, if you just Google Survivor Assistance at the VA, you know, there are links there. You can send us an email, and we do our best to answer those questions as quickly as we can. And I'll pass it back. Thank you.
Great. Thank you so much, Anne and Devin. Kathy, thank you again for the opportunity to present.
Thank you so much, Bonnie. And we want to reiterate that anyone is welcome to TAPS who's experiencing grief. And so please, whether you're a surviving spouse or child or parent or friend, use their resources. All of the links that were put up here will be shared on our website, and the links back to TAPS as well as the great resources shared by Veterans Affairs and Mortuary Affairs. Any additional questions that folks have for any of our panelists, send them in on the chat line. We will share them with the folks at TAPS and VA and DOD, and we'll get those answers up and back to everyone. The work that you do, Bonnie and team, is so important, and we are so grateful to you. All of us can own the sadness that we have now and encourage our family members to, and know that there's ways to make grief good. This is something I learned from Bonnie, and I think that's a very important message. Taking care of ourselves is taking care of our community. I'm going to turn it now over to Matt to talk about our future town halls. Matt, may I welcome you back?
Yeah, thanks, Kathy. I certainly want to echo Kathy and the rest of the panelists. Thank you for your time today. We know this is a busy period for all of you. I do want to remind everyone attending today to please check out your email following this town hall. You will all be receiving follow-up information regarding the discussion today, including a post-webinar survey. Please take a moment to take that survey. Your input is absolutely necessary to ensure that we're doing the best job we can, and that this information that we present during these webinars is important and relevant to you. And as another reminder, a link to the pain points poll will be provided in that email. Please take a moment to take that, and then I'll also share it with your contacts. Finally, I want to invite everyone to join us on this coming Thursday, April 30 at 3 p.m. for a report from the field on the innovative installation and community medical partnerships that are taking place across the country. We'll hear from on the ground how bases are partnering with communities and civilian hospitals to deliver innovative and needed medical services. In the meantime, be sure to check out our new website full of resources to help you and your family. And thanks again for joining us today, and we look forward to welcoming you to a future webinar.